Hello all. இன்னைக்கு systemic histology ஓட slide identification points தான் பார்க்க போறோம். Slide number 1. Try to identify the slide. Okay. இந்த slideல நம்ம என்னலாம் பார்த்திருக்கோம்? So topmost layerல ஒரு epithelium இருக்கு and beneath that submucosa and அதுக்கு அடியில ஒரு பெரிய layer of cartilage இருக்கு. So this cartilage is actually the hyaline cartilage because the cells in this cartilage are arranged in groups like this. The chondrocytes, that is the cartilaginous cells, are arranged in groups and the lowermost layer is the adventitia. So the epithelium is also pseudostratified ciliated columnar epithelium. Having this in mind, that slide is trachea. So trachea ஓட two identification points வந்து pseudostratified ciliated columnar epithelium with goblet cells that lines the mucosa and beneath that ஒரு thick layer of hyaline cartilage இருக்கும். And also mention பண்ணனும்னா serous and mucous glands will be present in the submucosa. So this is trachea. இது ட்ரக்கியோட எபித்தீலியம் ஓட ஹையர் பவர் மேக்னிஃபிகேஷன். ஸோ இதில் பார்த்தீங்கன்னா சூடோஸ்ட்ராட்டிஃபைட் எபித்தீலியம். ஸோ த நியூக்ளியஸ் வில் பி இன் டிஃப்ரெண்ட் லேயர்ஸ் பட் த பேஸ் ஆஃப் த செல் will all rest in the same basement membrane and on top of that if you see you can appreciate the cilia. Next slide identify பண்ணுங்க. ஸோ இந்த ஸ்லைடில் என்ன தெரியுது? some cut section ஒரு இருக்கு, like flower like cut section இருக்கு and around that there are very thin layer of cells. So this is the slide of the lung. So cut sections of intrapulmonary bronchi and bronchioles. These are the bronchi and bronchioles oda cut section. This surrounding part is the alveoli. The alveoli is lined by simple squamous epithelium. So in the slide பார்த்தீங்கன்னா you have to identify it as lung. Try to identify this slide. So இதை வச்சு ஏதாவது கெஸ் பண்ண முடியுதா? This is the slide of esophagus. You can appreciate the epithelium. The epithelium is stratified squamous non-keratinized epithelium. So stratified squamous na there will be many layers of epithelium and topmost layer squamous cells இருக்கும். So நம்ம ஸ்லைடில் பார்க்கும்போது இப்படி தான் தெரியும். So அந்த stratified squamous layer of epithelium தெரியும் and in the submucosa there will be esophageal glands. And in the muscularis layer it is made of inner circular and outer longitudinal muscle and the fourth layer is adventitia. So all these together form the esophagus. So the mucosa is lined by stratified squamous non-keratinized epithelium and beneath that esophageal glands are present in the submucosa and the given slide is esophagus. This slide, try to identify this. So in the slide la topmost layer la you can see some pits. In the pits la romba shallow ada irukku, they are not very deeper. So the pits are present only in 1/3 and beneath that you can see the gastric glands. So all these are the glands which are present, which is 2/3. So this is stomach fundus. Stomach fundus la da gastric pits வந்து 1/3 இருக்கும் and gastric glands வந்து 2/3 இருக்கும். So based on this we are able to find stomach fundus and the mucosa lining is simple columnar epithelium with shallow gastric pits. இதுக்கு அப்படியே opposite தான் next slide. So this must be, yes, it is stomach pylorus because the pits are more deeper in this. Very deep pits are present in stomach pylorus whereas the glands are only 1/3 whereas the pits are very deeper and they are 2/3. So this is stomach pylorus. So fundus க்கு exact opposite தான் pylorus. So the gastric pit நீங்கள் பார்த்திருப்பீங்க, it is 2/3 and gastric glands it is 1/3. So identification points for stomach pylorus are mucosa lining is simple columnar epithelium and deep gastric pits are present. So this is the difference between fundus and pylorus. ஏதாவது ஒன்று படிச்சுக்கோங்க. ஸோ ஃபண்டஸில் பிட்ஸ் 1/3 இருந்துச்சுன்னா கிளான்ஸ் வந்து 2/3 இருக்கும். ஸோ அதுக்கு எக்ஸாக்ட்லி ஆப்போசிட் தான் பைலோரஸ். பிட்ஸ் 2/3 இருந்தால் கிளான்ஸ் வந்து 1/3 தான் இருக்கும். நெக்ஸ்ட் ஸ்லைட், ட்ரை டு ஐடென்டிஃபை திஸ். So in the slide you can see there are many finger-like projections. So in the finger-like projections are actually the villi, and on the villi layum you can see there are some goblet cells present. Yes, goblet cells are seen. This is the epithelium, but main inge nama focus panna vendiyadhu enna this area. In the submucosa there are some glands seen. So villi is present and submucosa la glands is also seen. So what must be the slide? It is duodenum. So the mucosal villi is lined by simple columnar epithelium with goblet cell, and submucosal you can appreciate the Brunner's glands. So the slide is duodenum. So this is the high power view of the duodenum slide. So try to appreciate the submucosal glands and the foldings. These are the villi, which are the finger-like projections that is increasing the area for absorption. In the slide identify பண்ணுங்க. So previous slide மாதிரி இந்த ஸ்லைட்லையும் villi இருக்கு, but the villi are more extensive when compared to the previous slide, right? And beneath that there are some glands present. These are the two features. So one is villi and some intestinal glands are present. So the given slide is jejunum. Yes, in jejunum, mucosal villi is seen, which is lined by simple columnar epithelium, and these intestinal glands are present in the lamina propria. Next slide, try to identify this. In the slide you can have villi seen. So these are the finger-like projections that are seen. Beneath these villi இங்க என்ன இருக்கு? There are some aggregations which are present. So this is the key identifying feature of the slide. என்ன ஸ்லைடுன்னு பார்க்கலாமா? So this is the slide of ileum, and this ileum has Peyer's patches which is present in the mucosal layer and also extending into the submucosa. So Peyer's patches என்னன்னா, they are the aggregation of lymphoid follicles. They will have villi present along with that Peyer's patches present. So duodenum na Brunner's glands இருக்கும், ileum na Peyer's patches இருக்கும், jejunum la இவங்க ரெண்டு பேருமே இருக்க மாட்டாங்க, only villi along with intestinal glands. Next slide. So in the slide la epithelium la main we can see excessive number of goblet cells. Can you see? So if this is the epithelium, in the epithelium more goblet cells are only seen. So proportionately when compared to other cells, goblet cells are very extensive. So goblet cells are the key identifying feature for the colon slide. This is the high power view. So if this is the epithelium, and in the epithelium you can see extensive number of goblet cells. These goblet cells appear empty because during preparation of the slide என்ன ஆகும்னா உள்ள இருக்கிற mucus gets washed away. அப்போ நம்ம ஸ்டெயின் பண்ணி பார்க்கும்போது all the goblet cells appear empty. So they are lined by simple columnar epithelium with excessive goblet cells, and in the lamina propria crypts of Lieberkühn are present. This is the slide of large intestine. இந்த ஸ்லைடை கண்டுபிடிங்க. இதில் வில்லை இல்லை, ஆக்சுவலி போன இதில் பார்த்த எல்லாத்துலேயுமே வில்லை இருந்துச்சு, இதில் வில்லை இல்லை, பட் தேர் இஸ் சம் டிஃப்ரெண்ட் டைப் ஆஃப் gland which is present, and along with that you can see aggregations of lymphoid follicles. So these type of aggregations along with some of the glands like this அப்படின்னா அது என்ன ஸ்லைடாக இருக்கும்? It is appendix. So the lining epithelium is simple columnar cells along with goblet cells present, and the lamina propria is filled with lymphoid follicles. These are the lymphoid follicle aggregations which is seen in the lamina propria, and the crypts of Lieberkühn are also present. But villi in the slide la illa, adha nalla ஞாபகம் வச்சுக்கணும். And this is the slide of appendix. Next slide. எக்ஸ்டென்சிவாக பிங்க் கலராக தெரியுது, பட் சென்டரில் ஏதோ ஒரு ஸ்ட்ரக்சர் தெரியுது, அண்ட் இங்கே தீஸ் ஆர் சம் ஆஃப் த ஸ்ட்ரக்சர்ஸ் விச் வி கேன் அப்ரிஷியேட். பட் அதை தவிர்த்து எவ்ரி சைட் வி கேன் see only cells which are arranged like this. So this must be the slide of liver. So this is the slide of the liver where the radiating hepatocytes are seen, and this is the central vein. So hexagonal shaped hepatic globules with the central vein is seen, along with that portal triad is seen. So இதுதான் the central vein and here is the portal triad. Portal triadல 3 structures இருக்கும். The branch of hepatic artery, tributary of portal vein and the bile ductule. All these 3 together join to form the portal triad. So here you can very well appreciate the portal triad. This is the venule, this is the portal vein and this is the bile duct and here is the hepatic artery. So this portal triad is enlarged like this. Next slide. In the slide we are able to see that the mucosa is actually thrown into excessive folds. It is very much folded, yes, and beneath that only 3 layers. So finally there is mucosa, muscularis layer, that is the fibromuscular layer, and finally the adventitia. Only 1, 2 and 3 layers are present. This is the slide of gallbladder. So the mucosa is thrown into folds and is lined by simple columnar epithelium. Remember, gallbladder has only 3 layers. There is no submucosa. Try to identify this slide. So இதில் என்ன தெரியுது? Can you appreciate some different structures here? So what are they? It is the slide of kidney. Kidneyல outer cortex and inner medulla இருக்கும். We have to concentrate on the glomeruli. This is the key identifying feature for a kidney slide. So this is the slide when we see these are the glomeruli. So glomeruli high power la பார்க்கும்போது this is how it will appear. There will be a small gap which is present. So this gap is the Bowman's capsule. This is covering and this is how the glomeruli will appear in low power view. And these are the PCT and the DCT. All these are the cut sections. What is this slide? I think இது கொஞ்சம் டிஃபிகல்ட்டாக இருக்கும்னு பிகாஸ் எக்ஸஸ் the entire ஸ்லைடே வந்து ஒரே மாதிரி இருக்குது. பட் ட்ரை டு அப்ரிஷியேட் there are small differences which is present here. So some light stained cells இருக்குது. Around that everything is dark stained cells. But நான் இப்போ ரவுண்ட் பண்ணுறது எல்லாமே they are the light stained cells. ஸோ இந்த மாதிரி டார்க் அண்ட் லைட் ஸ்டெயின்ட் செல்ஸ் எந்த ஸ்லைடில் வரும்? It is the pancreas. Pancreasல தான் we'll be seeing islets of Langerhans cells. So these islets of Langerhans cells are light stained, whereas அதை சுற்றி இருக்கிற சீரசசினை எல்லாமே will be dark stained. So this is the high power view, but examல இந்த வியூவில் தான் கொடுப்பாங்க. So you have to identify the beta cells to identify the slide of pancreas. Next slide. So this is a bit of difficult only. Okay, let me explain. Here this is the epithelium. So this epithelium is umbrella shaped cells which is the urothelium. So here is the umbrella shaped cells. Yes. So umbrella shaped cells எதில் இருக்கும்? Either it must be ureter or urinary bladder. Only in these two slides urothelium will be present. Urothelium means umbrella shaped cells. So ureter oda identifying feature என்னது? Star shaped lumen. So when the star shaped lumen is not present, it must be urinary bladder. So this is the urinary bladder. So the mucosa is lined with transitional epithelium and thick muscular layer is present. Whereas in the mari star shaped lumen இருந்து and on top of that urothelium இருந்துச்சு அப்படின்னா that is the slide of ureter, because star shaped lumen is present in the center and this is the epithelium and this is the extensive thick muscular coat. So considering all this, this is the slide of ureter. So the mucosa is thrown into folds and is lined by transitional epithelium and thick muscular layer is present.